Yeah. But
It's 11 a.m. So we're going to start our meeting off somewhat promptly here at 11:01 maybe. And just to give all our guests some information, if you need more seats, we can pull them out. Do we need more seats? Let me pull out some seats real quick while I'm talking and let you know that we are going to move to approve that we move the public comments up to the top of the agenda rather than the bottom. So if folks need to get out of here for any reason or don't want to sit through some of the obvious minutia that we go through for an hour, they can be heard.
So are we on?
We are. We call the meeting to order.
I move item 10 to item above welcome introductions, below to item 2.
How about we do it like 3? Will that work?
Yeah.
That way we approve the agenda first.
So I move item 10 to 3.
1 second.
I'll second.
So moved. So I think I took care of welcome and introductions. Let's do introductions around the table so everybody knows who is up here, who we're talking to. I'm Darren Moody. I'm a hospital commissioner and I am the chairman of public board.
Oh, I'm Sharon Trask, Mason County Commissioner, District 3.
I'm Peggy Van Buskirk, and I'm from Hospital District 2.
Pat Tarswell, Mason County Commissioner, District 2.
I'm Rachel Armis. I'm the Health Director of Squaxin Island Tribe.
Eric Anisco, City of Shelton Mayor, also on this board.
Pete Linden, Mason County Public Health Director.
And we have some staff folks and some employees around that I'm sure if they speak, they'll introduce themselves as we go, if that works. Okay, we all have the agenda. Have we had a chance to review the agenda? And is there any questions, amendments, or otherwise?
I would make a motion to approve the agenda as amended.
Second.
All those in favor?
Aye.
So moved. So let's take item 10 and now put it at item 2.5, we'll call it. And is there a place, speaking wise, that's best for anywhere? Okay. So rather than have to move us around the rooms, if you want to speak, you're welcome to speak. Just stand up where you are and you can be heard. Well, it's not that big a room. If you would do so, state your name too and let us know. Yeah, 2 minutes? 3 minutes. 3 minutes. I'm sorry. 3 minutes per person is what's generally allowed in the public meetings.
I can start then, I guess.
Okay.
Sure. My name's Ryan. I'm with Taxpaying Citizens of Golden Pheasant. I'm here today to actually speak about a new campaign that we're going to be starting beginning next month. We've been working on trying to get certain crime-ridden properties that don't meet basic living conditions in our area of the county cleaned up and stop the crime problem, whereby many of the businesses and residences are being impacted. We're going to begin filing code enforcement complaints, extensively researched code enforcement complaints against the properties and shepherding them through the code enforcement process so we can highlight the deficiencies and report them back at this meeting to the board so they can find ways to make the process better and more responsive to citizens in the county instead of what has been the historic tendency to just shut the code enforcement complaints down when they're filed. Hopefully that will highlight some of the problems and make it just a better process for people. And many of these people are here today to speak to what's on your agenda.
Ryan, if I can ask you, you have a group name or?
Taxpaying Citizens of Golden Pheasant is us. There are actually other organizations here. We're all affiliated because we tend to be one-issue voters on this topic.
Thank you.
Mm-hmm.
Do we have anybody else that would like to speak?
You should speak second. Go ahead, Greg.
Yeah. I'm Greg Murphy. I live on Delight Park Road, and we've owned property there for over 30 years. And when we first moved there, it was a quiet, peaceful getaway for our family and for our kids. Today, it's scary. We can barely even go outside and feel safe. And my wife and kids don't even like to walk in the park anymore because it's too dangerous. There's too many, we've had confrontations with people there. There's a lot of code enforcement that's not being held up on the property up on Old Bell Road, Kelly Road, the State Park area, the boat ramp. There's all these illegal activities that are going on. And so I just really would like to have you folks understand and see from our viewpoint, what we're experiencing, what we're going through. like I say, it was a peaceful, quiet place up until 5, 6, 7 years ago. Now it's rampant with traffic 24/7. There's explosions all the time, there's illegal shooting, there's, you know, the police and the sheriff have responded multiple times. They pulled out, from what I understand, a truckload of illegal guns a few weeks ago. They constantly arrest people, there's warrants, there's people that, there's bad people up there. And we are really concerned as a neighborhood. And it's sad, it's really sad to see that this continues on and we're not making any headway as far as cleaning the area up to where we feel safe. I think you would address that. Oh, okay.
I think you're getting elected to.
Okay, so yeah, this is my wife. So anyway, right across the street from us and over one, there's a, I call it like a wrecking yard. There's probably 30 or 40 vehicles on this 1 acre piece of property. And from what I understand, the building in which they live and all the campers and motorhomes that are scattered all around those 2 lots right there are non-conforming buildings, and the sewage disposal, from what I understand, is going into the ground without a proper septic. This is going to affect our groundwater, not to mention all the oils and the liquids coming out of the vehicles. And we have codes to take care of these things, but they're not being enforced. And it seems like the county in a lot of cases is turning a blind eye to this, thinking that people have fallen on hard times. And I get it. I understand that people have difficult times. But we've got to find a solution that's good for the neighborhood, that's good for everyone concerned, and not just, I've personally spoken to sheriff deputies that say they're afraid to go up there. They're afraid to go to the property across the street from us. We've had, the other day, the garbage truck driver was on the phone for 10 minutes. And we think he was wondering if it was safe to drive up there and pick up the trash. I've heard from other neighbors that when they get a parcel delivered at their house, they've told my neighbors, now we have to go up there and deliver, and I don't want to go up there. So that type of thing is, yeah, go ahead.
You've used your 3.
Okay, good.
No, I just want to.
No.
Just keep an eye on my hand up here.
No,
If you
no,
speak,
no,
I'll
no.
just kind of raise it and give you.
No, that's a good start. Thank you.
One thing I will ask is if you talk about specific places, if you give a street address or a name, there is staff here that's taking notes and listening to this.
Okay.
So it would be a good idea, like you said, there was a house.
Yeah, Old Bell Road, it's a private road.
Okay.
And there's several places on that.
Thank
3 or
you.
4 houses.
Thank you. Anybody else? Yes.
I have one of those properties. I'm
Can you,
behind the junkyard.
you want to speak? Go right ahead, ma'am.
My name is Dixie Smith, and I own the piece behind where all the junk cars are. And when I bought that, and I think it was '07, it was a nice little place for 3 trailers to be. 1 mobile home was there. And it went fine for a few years. I said it's a moneymaker. Well, in the last 4 or 5 years, I've put almost $30,000 in the cleanup, demolishing things, and I'm right back where I started. People move in there without you knowing there, and they're, oh, I'm just gonna be a couple days to get my stuff in. One of them had been evicted from the junkyard, and he moved his motor home and junk up to my place. I said, you can't stay here. He's still there. That's been almost 1.5 years. And I have threatened him in every way possible, except with a gun. And I don't know, my hands are tied. I said I can't get help anywhere. And he did tell me the other day he's leaving within 2 weeks. I don't know. I put up a for sale sign and decided if I have to sell it, I'll sell it. But you know, I bought the property thinking, keeping it in my family, and, but I'm at loose ends. I don't know what to do. They burn. I've got a ticket right now for $500 for fires going there. I tell them they cannot build fires, they build them. They plug into my electricity up there. And my light bills last winter were running $500 a month for a pump house. Cause they put, and the minute I'm gone, they plug it back in. I've had $9,000 worth of electrical stuff done up there. So I'm willing to fight for anything to get it straightened out, cause I just can't do it. I'll have to sell it, and that's sad because I don't wanna give it away, but that wasn't my intention.
Normally, I don't interact that much with I let people speak, but I wanna ask you, you own the property that these
Yes.
people? Have
The
you gone to
one-
the
the
sheriff's
one
department,
I-
civil division, and asked for eviction?
I don't, huh?
Have you gone to the sheriff's department, civil
I've
division?
gone everywhere. More
Well, the
than
civil
once.
division handles evictions specifically for what you're talking
The
about.
only thing I can do is do an eviction, and I
Right.
did that once, and it was like $8,000. And the lawyer, I never even met him. So he just did the paperwork.
I
said,
would,
"I'm
I
not
would
doing
make
that."
one suggestion, that maybe you make an appointment with the sheriff's office civil division to have this conversation. You shouldn't be paying $8,000 for an eviction. You certainly won't pay the sheriff's office $8,000 for an eviction, and they will go out and serve the papers personally.
That's-
So I'm just giving you some suggestions. You can do whatever you wish, but I'm
I've
telling
been in
you.
there a few times, and I know some of the deputies.
Yeah.
And, it's like their hands are tied too. So,
Okay.
it's like you go in a big circle,
Thank you very much, ma'am, appreciate it.
okay?
Thank you.
I have a long, long story, I could talk for a couple hours. I won't.
Okay, do we have somebody else who'd like to speak?
I'm Dave Butts. I'm the one that's on Ben Swagger that dealt with Casto for fucking 3 years.
Can you do me a favor?
I know, sorry.
Thank you.
It just pisses me off. or what
Yeah, I
happens, so,
totally get it.
all you're doing is trying to make it easier for you guys to not do your job on this stuff. It's not right. I had to deal with Casto. She had her tank, literally, it's a water tank only that she's draining her sewer in, and the county wouldn't do nothing about that. And I know she's just popping the cap and draining her crap on the ground right over the top of the well. It took almost 2 years to get her just to move the water tank that she's draining her stuff into to get it away from the well house.
So for those of us who are new to this table, I have no idea who Casto is or what you're talking about, but
So
evidently,
I know you don't, but there's 3 people at this table
but
that have dealt with me.
I'm just saying, so what street are you talking about?
On Ben Swagger,
Lynn Swagger. Okay,
yep,
thank you.
yeah.
Anybody else would like to speak? Yes, ma'am.
This is pretty emotional for me. I live next door to the junkyard. And they've always been, the owner there, his name is Matt. He's a very sick man, but he's always been very nice to me. The guy behind him on Dixie's property in the mobile home, motor home, is always building fires. And he's building the fires at night when he doesn't get caught. And he's burning his garbage. And I'm getting sick. I'm always sick because of the smell of his garbage. And he's burning styrofoam, plastics, anything he can have out there. He just builds a big fire and then he spreads it all out. And then we have to smell it. They live across the street and they can smell it out there. So there's no regulation. The fire department comes and tells them to put it out, you put it out, next thing you know, he's gotta start up again as soon as they leave. So there's no regulation or anything, no penalty for doing this kind of thing. There's a fire hazard right now because there's a, what do they call that,
No, it's a burn ban.
burn ban, yeah. And he doesn't pay any attention to it. Nobody pays attention to it. They burn if they want to. And next door at the garbage place, car place, they are working 24/7 because our house is right next to them. And our bathroom window upstairs looks right over into that place. Well, every time I go in there, I'm looking to see, and many times I see flashlights. And then ting, 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 tong, tong, cars being ripped off and, parts being stolen and stuff. One time, the ambulance was called because there was a ruckus over there or something, the ambulance didn't even know where to get in. They didn't even know where the person was because there's fence around it, there's gates, there's everything. I mean, and there's squatters, people squatting. And where are they going to the bathroom? Where are they, it's an environmental hazard. It's bad, it's really bad. So I sympathize with Dixie and what she's going through and see what happens over there. If this man leaves on his own in 2 weeks, I'll be real surprised because he won't listen to anybody. The police have been there several times. I have talked to some of the policemen and they don't know what to do. Their hands are tied. Well, if the police are there and their hands are tied, what are we supposed to do? I mean, this is dangerous, and it's dangerous to be out there. And I won't go out after dark because I'm too afraid that something would happen. And the dogs run wild out there. There is no county law about the dogs, and the dogs run wild. My husband has had to put up fence all along the whole way to keep the dogs out. And they come over and they raise ruckus and they chase our cat, they chase the cats. It's a mess. It's really a mess.
Thank you very much.
And I feel bad because I have to report this. And I'm just tired of it. We're just tired of it.
What's your name, ma'am?
Patty Kempton. I live on Delight Park Road, right next to West Old Bell Road. And sometimes the garbage truck can't even get through on the day that it comes on every other Friday. The garbage truck can't get through because there's too many cars in the way and they have to wait and go real slow and make sure they don't scratch anything because they get in trouble for that. It's really a mess and nobody is checking on it. Nobody is doing anything.
So can I make a suggestion blanket wide? In a prior lifetime, I had a career as a police chief. And I told people all the time, call. Even if you think nothing's getting done, even if you think nobody's paying attention, call. Because that registers as a call for service every time somebody calls. And the more calls for service that add up, the more attention it gets. And I understand the frustration, I do, of I call and nothing happens, I call and nothing happens, I call and nothing happens. I totally understand that. And Ryan can tell you later why I understand it where I'm at. But I will say this, please don't stop calling. When there's fires at night, etc., please don't stop calling.
This is my husband Dan and he calls all the time.
And let me mention briefly, the police have directly told me, it's not a law enforcement issue, it's a code enforcement issue. They come, they act, they arrest, the person comes back, they've got another visitor causing problems. They said if code were enforced, they wouldn't be living on these lots. The problem would be cleaned up, at least in our section of the county. I cannot speak for elsewhere.
That has some truth to it, but not all. Not all. So the fires are a totally different ballgame, and that's what I'm talking about right now. Is specifically your fires, etc., booms in the night, things like that. We're dealing with a fire up here in the county that's been going on for the last 3 months. 4 months. And it's caused all the haze around our houses and everything else, and it's caused by somebody doing something stupid. Excuse me. So thank you very much, I appreciate it.
I'd like to say for the fires, the burning of the garbage, ORCA has teeth. File your complaint with ORCA, a Olympic Clean Air Agency.
I've done that twice.
They will write tickets. So
Yeah, we
keep
haven't
calling.
showed up.
I keep calling them, they will write tickets,
I'll
so.
keep filing.
It's not just the garbage.
Okay.
Any burning.
Before we start going, if there's somebody else who wants to speak, let me know.
There's been points when I couldn't walk out in my own yard because of the smell of burning off meth lab.
Would you like to speak, Mark?
You have to stand up. You have to
You can
stand
do
up.
it.
Oh, I'm sorry.
There we go.
Wasn't just citing her, but my sympathy goes out to her. Because there's been times when I couldn't even walk out my own door down the hill because of them burning off the remnants of their meth lab. How many people know what hazmat is? I've done a hazmat course, I know. And it causes respiratory problems
What was your name,
for
sir?
everybody in the neighborhood.
What's your name, sir?
My name is Mr. Mark Richardson.
And what street are we talking about, Mark?
I'm sorry?
What street or road are we talking?
I'm at 830 West Delight Park Road.
Delight Park, got it. Thank you.
We're talking about the people across the street next door to her.
Thank you very
And
much.
there are animals that run wild constantly.
Thank you very much.
You're welcome.
Anybody else? Yes, sir.
Yeah, briefly.
My name is Pat Burke, and I own American Cushion Industries on Golden Pheasant Road. And I've been out here 33 years this year. And man, I can tell you, this just didn't start yesterday. When we first got up there, things were pretty good. Slowly, things started to decline. Started when the first wrecking yard across the street from where Verl is now went out of business. That turned into an absolute meth-fueled hellhole. Up to including a murder in the back building. One guy hung himself in the garage. I knew that guy a little bit. He was a friend of mine. And I personally, on 2 different occasions, have had to pull a firearm on people up there. And I'm licensed to carry, I know what I'm doing. And if I hadn't had that gun, I'd probably got my head caved in. But when you pull out a firearm, it gets people's attention and they start listening to what your orders. But I've had the occasion where there's a fellow by the name of Legault. He's the brother of the late Ace Legault down Neil's Pharmacy. Has a piece of property just down the street, kitty corner from me. Always has been a problem. There's been a meth operation in there. People driving in and out all hours of the day and night. And we're not talking about old junk cars. We're seeing new Mercedes Benzes going in there, late model vehicles, and. It was 2 years ago, I guess, my woman that runs my office called me at home and says, Pat, you gotta get down here. She says, somebody has dumped a trailer in our front yard, right in our parking lot, and she says the smell is unbelievable. So I got down there. And I knew exactly where the trailer came from, because I used to walk down the Delight Park Road to get some daily exercise. And they were using this travel trailer for an outhouse, and they finally filled it up. And at 2:30, I guess in the morning, somebody seen them pull it out of there. They pull it out and they dump it in my yard. It cost me $1,000 that day to get rid of it. And it took me all day to find somebody that would take it. You know, I sued the guy, Legault, in small claims court. He contested it, but I won. And amazingly, he paid me. I couldn't believe it. Wow. But that included leaning his property to get the money out of him. So I'm telling you, that particular piece of property that trailer came from has been purchased by somebody. They've cleaned it all up. It looks like somebody may be residing there, but I still don't think there's any septic system there. Now, I offered Mr. Tarswell here, I met him at a meeting over Christmas time up at the business administrator, I can't remember the name of it anymore. And I invited him to come out and visit me and let me take him on a 20-minute tour of that area. And I've never heard from him. My neighbor David has tried to contact Miss, what's her name over here? Trask, and has had no results in contacting her about the problem that we both, see, him and I are next door neighbors. We live on the same street. And him and I both together have got over $30,000 in legal fees fighting this woman. Now, she seems to have money for attorneys, but she hasn't got money for a septic system. And when she moved her trailer, her tiny home in there, it was like, she didn't have a permit, nothing. Even the building, the tiny home was illegal for the state of Washington. It didn't have the correct stamps on it and approvals. And Dave told me we introduced ourselves, we caught her and her boyfriend out there. They were on the property. We went to introduce ourselves, had about a 10-minute conversation with them, and I went back to Dave the next day, and Dave says, Pat, he says, they're telling me they're just gonna run their effluent out on the ground, because Mason County doesn't enforce their codes. Yeah. And I says, Dave, don't get too close to these people. Oh, am I overdue? I'm sorry. But anyway,
let you finish your sentence. Go for it.
But anyway, there's a group of people here today, including this gentleman over here. We're going to be contributing to his organization. And we're going to make sure that you people, whoever you are, do your jobs. You've been elected or hired to enforce codes. You're not going to get away with modifying the codes to make your jobs easier. It ain't going to happen. You've got a problem if this is what any of you are thinking. Thank you for your time.
Appreciate it.
And I think you wanted to speak.
Hi.
Hi.
My name's Susan Nelson, and I live next door to Greg Murphy, across kind of 2 houses down from Old Bell Road. Patty is not the only one who's getting sick from the smoke. It is so bad, and the smell is, I don't know what meth smells like, but I've heard it's a meth lab up there. But it smells like plastic, it's not wood, it's strong, it makes my daughter and me deathly ill, we can't go out, it's thick, and they burn like at 3 in the morning. They're just very strange. I get woken up all hours of the night from cars revving.
Yes.
And then I think, you know, these guys are so neglectful and irresponsible. If a fire were to break out, seriously, those cars that have gas in them, they would all blow up. The whole neighborhood would go up. With our pine trees around, I live in fear constantly. I used to jog religiously every day down Delight Park Road, Golden Pheasant, down to 101 and back. No problem. Now there's 3 like pit bulls or something. They come into our yard. They're there all hours of the day. We try to shoo them off. We can't let our little chihuahua out. I don't know if they're nice or not. They were aggressive one day, but they have no consideration for the neighbors, period. None. As far as they're concerned, they own the entire neighborhood now. They're gonna burn when they want to. They do what they want to. There's been illegal guns confiscated from there. There's been an overdose up there. And I don't know how many dead bodies at this point, but I don't even walk out the front door. I won't even go down to my dock because of these dogs. I don't know if they're gonna be in my yard. I see them in the Murphy's yard. They just run wild. It's just not fair. It's not fair to us tax-paying, legal people who are trying to have a lovely life on Lake Isabella. It's a friggin' nightmare.
Thank you.
And that's all I can say.
I'd just like to add something because they're all saying, they're kind of going off of what you are gonna be talking about. But the problem is these people are living there because these codes are being violated. And now you wanna change these codes to make it easier for these people to live there.
No.
So this is not what we want.
That's not gonna fly.
Can't have that.
We need to start doing something about, if they would've done something about Castle in the first place, we wouldn't have been here.
That's right.
That tiny home would have been gone. The first day I went down and complained, nobody did anything. So if we'd start doing what we're supposed to do, our jobs, and get this stuff taken care of, we wouldn't have these problems.
So let me give everybody kind of an overview quickly of who you're speaking to here. We are the County Board of Health. The County Board of Health is made up of officials and people from all walks of life. Example, we have county commissioners, hospital commissioner, mayor of the city, and so these are all people that are into the, did you get it? They contribute to the Board of Health. And then we are also, the code enforcement and stuff does not work directly for us.
No, we do.
You do.
Yeah, well, so there's 2 lines of authority. So there's 2 lines of authority. So the authority for the health department comes from state constitution to state board of health, to this board of health, to us.
Correct.
And that's code enforcement.
Got it. Does that help a little
He's
bit?
the boss.
Yeah, he's
That's
the,
right, he knows what I'm talking about.
yes,
A fast question.
yes,
Do you still have a county health doctor?
yes.
Yeah.
Why is he or she not present here today?
Well, that's a good question. I will be.
Usually they come through on Zoom when we have our meetings. If people can't make it, they come through on that.
Yeah.
Usually. I
I
don't
think
know.
that doctor should be present for this meeting, whether it's former or not.
Well,
I agree.
agreed. And there is a
We're gonna have a typhus outbreak here one of these days. If this kind of crap continues on.
if you let me finish,
Okay.
there is a county health officer. And that county health officer usually is attending our meetings. And that county health officer gets a full report of everything that occurs at the meetings. And that county health officer then gives other reports to what has occurred at the meeting and what's going on in this county. So yes, there is one. That's assigned to this group. Anybody else would like to speak?
Yes.
Yes, sir.
Robert Golden, taxpayer citizen of Golden Pheasant. So it's obvious you've got an issue with code enforcement, and while you mentioned it's a health department issue, these code enforcement things they're not being enforced speak to it is a hazardous health conditions, so they should be involved. So this draft proposal to modify the existing WAC is short-sighted, and instead of the board putting their energies into that, they really should be putting it into the issues right in front of you, and adding another, putting in rules to give those who do bad more room to operate in is very short-sighted, and I don't, it's not in the interest of anyone here. Thank you.
You bet. Anybody else?
One thing I wanted to say, on the Old Bell Road, when they were talking about cars blocking, the Old Bell Road is an easement road. There's my place and there's 2 or 3 more places, three more I know of, beyond my place. And he parks those cars on the easement. That's why the garbage truck, the ambulance, none of that, they've all run into problems. And Mr. Bell lives on a couple houses past me. He had a medical emergency. It's keeping any of us from getting help. And I finally got the garbage truck to come up because the health department worked with me and I have to have garbage now, so I pay for that. And it's just ongoing, and you tell them to get the cars off the road. I bent my bumper up one day trying to squeeze through those cars.
Thank you.
And Nancy, I have a
Is
suggestion
it-
about that for after the meeting.
Is there anybody else who would like to speak that has not spoken today?
There's one person on Zoom, right?
Oh, I'm sorry. I was not paying attention to Zoom. Is there public on the Zoom meeting that would like to speak? Who would that be?
That means you, Paula.
Oh, hi, I'm Paula Johnson, and I'm here to weigh in on changes to the septic waiver process.
Go right ahead.
Oh, okay. So the proposal that's being put forward, I think Ian's gonna cover it in detail in a little while. But it's just to make septic waivers expire along with the septic design that they are attached to. And I wanted to offer a counter proposal. I've been a septic designer for 20 years in Mason County, and I am also on the on-site advisory board. And I just think we could come to a compromise to not put unnecessary fees on to property owners, but still be following the regulations that are put down through the state. So instead of just having the septic waivers expire, I would propose that as long as the waiver mitigation still meets current codes, we should allow the existing waivers to be utilized for up to 10 years, which would be 2 concurrent permit renewal and extension cycles of 5 years each from the original waiver approval date. And then also, if the waiver mitigation no longer applies, because the state regulations have just changed and some properties no longer meet minimum land area requirements, those waivers should expire at the 5-year expiration date of the original septic design with an extension. And a new waiver would need to be submitted along with a renewal if applicable. And then also I would propose that recordings related to waivers do not void unless they are affected by code changes or if a parcel is modified and say the parcel number changes. I think these changes would allow the county to enforce state code, but also not put double fees on to homeowners and property owners. We just see that it is taking longer for people to develop property because of costs and permits and regulations. So I thought this was maybe a win-win proposal for the public and for the county.
And I just want to add that Paula did send her proposal in writing, so we do have the details of that in writing as well.
Thank you, Paula, appreciate it.
Yes, you're welcome.
Is that included in our packet?
Is that in our packet, Ian?
Did it make it into the packet? It came late, it came yesterday.
Maybe you can just shoot an email to us with it? Yeah. That would be good. All right. Yes, ma'am.
What is a waiver? I mean, your septic permit runs out or whatever, and then they're gonna give you a waiver. What is a waiver?
So a waiver can cover a number of things, so it may be a setback from a tank to the foundation of a house, or it could be any number of the design elements in a waiver.
Is there a time limit involved in this waiver?
Typically, like she was just saying, there's attached to the septic permit that's going through the review. Ian, you want to add anything to that?
Yeah, so when you apply for a permit for a septic system, and you find that there's one element, one design element that you can't meet, like Dave said, then you can say, I need a waiver for this part, and there's a whole set of criteria that's built into the code and built into the state WAC, and they have Rs and Gs for that. So that allows you to do some extra treatment to your septic system. You have some part of your septic system that is better than the standard, so that mitigates any risk to not meeting that setback or whatever that thing is that you're getting a waiver for.
Is there a limit, a time limit on the waiver?
Yeah, and so what happens when you apply for a waiver, that's part of that septic permit. You're having that modified. Previously in Mason County, we were treating waivers like they were their own separate permit, and they didn't have an expiration date in policy. So that created a problem where someone would get a waiver approved, say in 1999, and then in 2023 they come and apply for a new septic permit. That system was never put in, and they apply for a new septic permit, and this waiver that would have no possibility of being approved in 2023 is now good to go for this new permit application. So it was a misinterpretation of the state WAC and how Mason County was utilizing it, and the purpose of this particular not regulation change, but this policy change is to clarify what the WAC is requiring and make it clear in our policy that waivers that are approved, 20, 30 years ago they're not approved for current day use. They have to be attached to a current permit application.
We are all on septic out there, and somewhere along the line, each one has to be pumped. And so you get a report, you get a report from the septic company that, yes, this tank has been approved and it's okay, it's been pumped or whatever, and then you're good to go. But I know for a fact that next door, where all the cars are, there is no septic. There was a septic because there was a house there, a mobile home there. It burned down, and then they started moving in motorhomes, camp trailers, just, stuff. And who's going where?
Yeah, and this waiver policy that Paul's discussing would affect that
waivers, which I can do.
You can't get a waiver not to have a sewer. They have to have a septic. They can't get a waiver just not to have. They're in violation. That's the county code that's supposed to be doing something about that.
I don't think they even know what a waiver is.
I know.
That
I would
reminds me
probably agree.
also, there is a septic down by the boat launch. I don't know if they ever fixed it because they were willing to pay the fine, but it was literally running into the lake.
No.
Does anybody know if that was
he hasn't fixed it.
So this person chooses to pay the fine and then contaminate the lake, which is not healthy. That's a health problem right there.
So I'm going to ask that we wrap it up, because we do have other things on the agenda we need to discuss as well as this. And I appreciate everybody coming in and taking the time out of your day to come have this conversation with us. In full disclosure, I'm kind of your neighbor, so I'm aware of these issues.
And we're still open, Mr. Carswell, if you want to do her.
Go down to the side.
Come see what we do for a living.
So thank you very much. If anybody has anything else they'd like to add before we close it out, I'm going to close out the public comment. All right?
What
Yes.
is our next recourse?
Well,
What do you suggest we do?
Depends on the issue.
And it's hard to give you
I know, but you can see how we feel.
Yeah, I know. Some of the issues you expressed are going to be other departments. Does that make sense?
But getting passed on doesn't help us,
No,
what's something concrete we can take away today?
no, and
As far as-
there's two bodies that regulate what you're talking about. And one is the county commissioners and this body. And when we talk about the issues that were raised here today, specifically, I'm gonna go back to the fire issue. That's not necessarily a code enforcement issue, that is a law enforcement issue and an ORCA issue, as Eric brought up, the Clean Air Act. So there are some issues that can be dealt with other than code enforcement, that have to be dealt with other than code enforcement. And so it's one of those multidimensional, it's gonna be, I encourage all of you to talk to the sheriff's office, because, and I know you have, and trust me, I said, in a prior life, I've been in that situation, but I can tell you this, when people stop calling is when things stop happening. Does that make sense? Because believe it or not, I know Sheriff Sperling enough to know when Ryan's phone starts ringing off the hook, things are gonna get done. And it's not gonna ring off the hook if we give up.
If I can help, I think the comprehensive code enforcement complaints along with complaints to adjacent agencies like he's mentioning that we'll do next month will be the way forward. And then we'll be able to report to this body and perhaps the main board for the aspects that touch that, how it failed. Because likely it's going to fail.
And you know, I tell people all the time when we do the neighborhood watch groups and things like that, keep a log. Keep something by your phone, keep something by your, and write down the dates and times thing occurred. Write down any cars that come through. Write down the information, because the benefit to that is when we ask for specific, when the enforcement action needs to be taken and they need specifics, you've got them. Rather than generalities. I can tell you that there are times as a board member up at the hospital that I will get people calling me going, let me tell you about the service I had at the hospital. And they will tell me about something that occurred 10 years ago. And I'm going, I can't fix that one. So we can give anecdotal for days, but it's much better when we have, like you said, comprehensive, spelled out, this is exactly what we're talking about. This is the time it occurs, this is who is occurring, this is where. It makes it a lot easier to put this all together in a pile. It helps. It helps. And like I said, don't give up. When you give up and stop calling people is when we just throw up our hands and we're right back to square one.
This will be one of the most comprehensive complaints the county's received. It will be, with all the data you are gathering, we'll put it together and we'll talk after.
And I would encourage, since you're all neighbors and friends here, I would encourage folks to get with Dixie and let her know that there's an eviction process it can go through that's fairly inexpensive, and the sheriff's office does it for you. And get these people off the property.
I've never heard that before.
Get the people off the property. That's gonna be the biggest step.
I have a couple curious questions. What about the innocent victims in this place? The young children that are being taught that it's okay to live this way, and it's not. It's appalling to know that these children are being treated like this because of poor education. But the drugs and alcohol that they're being pulled into is almost worse than the compound in Belfair.
Nobody's arguing that one.
Yeah.
Nobody's arguing that.
And the traffic in and out at night isn't the only part, it's the tramps walking up and down and through the yard stealing everything they can get their hands on. I'm on guard duty at night between 11:30 and 1 o'clock, walking the property. And I've seen and experienced these people. A friend of mine went to the boat ramp just to do some fishing. Wound up having to pull a gun on somebody to keep from getting killed. And this is a devastating thing that we're into, and I want to know what it is we, as people and property owners and area keepers, can do to help get rid of this.
I think we've answered some of that for you, and I think Ryan's got some other answers for you, some other ideas. And if you have any questions, you can feel free to contact us anytime.
You guys are bringing up go to commissioner meetings.
Okay.
Yeah.
So I appreciate it. You're welcome to stay for the meeting, but we're gonna move on from the public comments. Thank you very much.
Thank you.
Mr. Chair, if I could say something just for a minute.
I'm sorry, go ahead, Mr. Tarsnell.
Before you leave, one of the things that we have been trying to get in place that is addressing this sort of thing, because I've been hounding on the sheriff and on every division. What the sheriff has been in forever is react mode, right? They get a call, they react. They get a call, they react. That's all they've ever been able to do. With the pressure that this commission has been putting on, he's put in a set. It's called a strategic enforcement team. Officers that their job is to go out and handle problems just like this. Not to react, but to go out and proactively do policing. It's never happened before. So this is something that I know it's really slow. I apologize that it takes so long, but that's what happens. But this is one of the steps that we're trying to do to bring you some relief, because we know this problem. It's not just your area. I know you're the ones who are living there and you feel it, but it's over the entire county. So he's got 4 officers now. Their job is to go do proactive policing. So they're not gonna be waiting for somebody to call them before they go out and take care of some of these things.
Mm-hmm.
So it's taken forever to get this going, but it is happening slowly.
The
So-
sad thing is how bad your hands are tied behind your back while you're trying to do your job. And that's the hard part. And then when I talked to the fire department, he goes, yeah, we're waiting for the explosion so we can go and put the fire out.
I just wanted to give you a little bit of, there is stuff happening that we're working on.
The wheels of justice turn, even though they turn slow. It's having the patience to understand that we're only people, but we're sick and tired of everything that's going on around us
We're gonna take a 2-minute break
without being
for the
able to
board,
do
and we're
anything.
gonna kick back in with the next agenda item. Thank you.
Hey, Pat, I'll go out with you too.
There's our time. Timekeeper says we're here. We'll resume the meeting of the Mason County Board of Health, resuming at, what is it, 11:51? Yep. And we're gonna go with item 3, approval of minutes from July 22nd. If we've had a chance to look at those.
I make a motion, we approve the July 22nd, 2025 meeting minutes.
Second.
All those in favor?
Aye.
So moved. Tribal update.
Hi, nice to see you all in person. So cool. I don't have an extensive update. Our team is just working on a pretty comprehensive mental health crisis plan. We have some people doing training right now with the state, doing some other things. But we're looking at a collaborative, comprehensive mental health crisis plan amongst the tribes. So as that continues to develop, I'll certainly give you all update. I mean, there's shortages, as we know, in crisis management across the state, not just the county. And then I wanted to introduce 2 new people, part of our team. So this is Maisie. She's our public health fellow who's going to be doing some projects. She's working on a community health assessment, and we're really starting to rev up our public health services within the tribe. And then Patrick is our public health support specialist as well. So I am going to be having them most likely attend in my spot, which makes sense. But that's really all I have for the group. So, thank you.
Thank you.
So not quite 15 minutes, short,
We
sweet.
had just started a discussion, the Rural Health Association is working with the Colville Tribe and others we have the Rural Health Transformation Plan coming out, and I didn't realize it was being spearheaded by Healthcare Authority and not DOH. So
Oh, yeah.
Yeah, so that was a little change for us, but, so, working with the tribes to try to bring in that money through the Trump administration to make it as an approved plan as possible.
Yeah, thank you for going after that. I think our state needs to also invest in mental illness. I think that's one of our biggest issues that we have right now.
Yeah, it is a challenge.
And I know the tribes, what tribe was it that's building the whole facility? We went to Dave, it wasn't Nisqually, it was.
Nisqually did build a new
Facility.
facility
Brand new
though.
facility,
Yeah,
So, yeah.
it's pretty extensive.
Yeah.
Yeah, so.
All right.
Thank you.
We're gonna scratch number 5, because doctor is not here, much to the dismay of 20 other people in this room. hoping he would be.
Plus the board members.
Yes.
Well, count as a 20.
Yeah.
Administration report, Dave?
All right, fiscal. I didn't actually do my written report this month because there were so many things changing so fast. I couldn't keep up. So we finally got our Foundational Public Health Services money yesterday. That should have been here on July 1st. So we've had a problem between DOH and OFM in getting our money to us in a reasonable time. And one of the problems that happens when that happens is, first of all, it kills our cash flow because we're working off of reserves. And we've got the reserves. We were smart enough to put money away. We got reserve. But at the end of June, we have to turn in unspent funds. Well, now we have 3 months we have not been able to spend funds. So we will lose 1/3 of it, or 1/4 of that money back to the state in June because we have not had the ability to spend it. And then they cut it back out the following year. So this year we already lost $392,000. And we sent back almost $600,000. It's not just the ability to spend it on timelines. Part of that is it's a chronic inability to recruit. So, we're sitting here between two metropolitan areas, and it's impossible to hire an ARNP because the other two, Kitsap and Thurston, pay so much more. So, we can put an ad out there for over a year and get 0 applications.
Which we did.
It took us 2 years to get our last nurse because of the disparities in travel nurses, especially during COVID, travel nurses were the hot item. And it's just
made a fortune.
And they made a bunch of money. So it's made it difficult. And what that does is it changes the fiscal system that we have to work under, and you're always playing catch up to the previous year, and it makes it difficult to move forward. So I've got requests coming to the county. We'll see how it goes. They're policy level requests. I've got 3 of them in there, Commissioner, and some of it's to address this very stuff that we've been talking about today. So one thing that we've not had in the past, we've not had an abatement fund. We need an abatement fund. In the building side, there is an abatement fund, but there is not one on the public health side. So that's one of the things we're going to be talking about with the commissioners.
So here's my layman question on that. Can then one abatement fund be available for both? Or does it have to be a separate fund?
No, it has to be separate, because you can't have one fund supporting another fund.
Right.
From the auditor's point of view.
So we can't have a county abatement fund,
Right.
we have to have a specific.
Because of how they're funded. So if funding comes from building permits and fees, it has to go to building. It can't come over to public health.
Got it.
So that's just an auditor's thing. So, and a lot of people don't understand that public health is not, we don't get a county contribution that pays for code enforcement. Our code enforcement is paid for by tipping fee, a small tipping fee, and then by the grants that we've gone out to do code enforcement. So there's no county contribution. In fact, our county contribution is 6% of our budget, and then the county takes back that 6% in overhead. So it just comes to us and then goes back. And that's pretty typical amongst counties.
I was just thinking out loud, your RNP, your nurse. I was curious, Bo, they started the other outreach program down here and they were able to hire 2.
And we're contracting with them.
Okay.
So,
because I was just thinking, how did he get, and I remember they came and presented at a hospital meeting,
Right.
and the 2 folks that came and presented said, we love nursing. We didn't like the ER environment, and now we're doing this.
Right, so, and by us contracting with them, that helps both of us. Gives them, more money for an ARNP. And it gives us, so we can contract to, and we don't have to have that person on staff.
Got it.
So we don't have full access to them all the time. It's just a way of things right now, so.
I'm just curious as to how he went about recruiting too.
Yeah.
And he was able to get them pretty quick.
In public health, generally, we get nurses who don't want to do shift work anymore.
And that's, yes.
So
It
that's.
was only part-time to start, that might have been on.
Yeah.
It was very limited hours.
So you mentioned that the state delayed, was three months getting you their money, and yet the state wants to take back money because you had
unspent funds.
You can't challenge that and say,
We're-
we'll start the clock when you get us paid?
We're starting to with other counties who have the same problem that we have. You know, we went through this process in June and we lost 19% of our budget and Seattle lost 2.3%.
Yeah.
Because they're better at spending money. You know, and it's just a difficult place for us to be, you know.
I was just curious about the pushback. Is there?
We're pushing back.
Because that seems ridiculous.
Right.
It's their fault you have unspent money, but.
Right, so we had this same problem in 2017, it took a long time to get contracts to us. Wasalfo, our state organization, has been pushing really hard on DOH. There's a new Secretary of Health, I think that's gonna be better, but part of it is OFM, and they're trying to get all these contracts out. The commerce contracts were late, ecology contracts were late, our contracts were late. If we didn't have a fund balance, we'd be having to lay people off until we got the funds in.
You do a 3-month, close the doors.
Right. So along those lines, we get the federal budget coming up the end of this week. If the federal budget does not pass, we will probably have to close WIC for the time being, because that's direct federal funding. So,
Is there any other direct federal funding, or is that it?
that's pretty much our only, I mean, we don't do a whole lot through the feds. So WIC is one of them. We have some prevention, and we have communicable disease, right?
Is that federal?
There's one piece of it, that's a small piece. And then we got a contract for $125 to do communicable disease work.
That'll print a few flyers.
Yeah.
Maybe.
Yeah.
Is that really even
Wow, I looked at that from DOH, I'm like, wow, you gotta be kidding me. So if we do wind up having to close WIC, we'll move staff over into other things until we get, the funding does come back through. Because I see that at some point they're gonna bring the federal budget back, it's just, I'm not sure when. So we're looking at that, we'll keep staff on board. I found another $200,000 through a grant called the Public Health Infrastructure Grant, and that saves 2 jobs. So that'll save 2 that we would have lost. So, and that's only for the next year and a half. So I've asked for an additional amount of money from the unspent funds to be added to that. They would keep it on for another year. So that keeps basically our front end staff full and supported.
I think we need to bring our representatives, our legislators into this conversation as well, so that they know why the money has to be, or was sent back.
Right.
And how it's not being sent to us. I sat through OFM's briefing to WASAC on Thursday, and that was the worst fiscal update I have ever sat through, because there was no explaining, no reasons why, there's no dedication to it, so.
Right, so, most of my job anymore is out trying to hunt down the funds to keep the doors open, so, and staff where they're at. On a happy note, we did get our mobile unit in, so we're able to take public health out of the office now and get out on the road with it. The list price was $325, I got it for $209. Used, and when I say used, I mean so slightly used, 3,200 miles on.
I call you when I get my next car.
Yeah.
Let's break into good
We got it, we did a good job of negotiating on that.
So
And-
can you give us, like at 10,000-foot level, what this is gonna be?
Yeah, so we just retired our motorhome that we use for syringe exchange, which is the smaller part of that. Our goal has been to get public health out, so we can take WIC on the road, we can take WIC to Hoodsport, we can take our crew out. We've got the syndemic grant, which we're under contract to do. We have to have a unit that goes out, and we just had to have our motorhome crushed, basically, because it was so bad. A1Cs and blood pressure checks and working with our senior citizen population. The idea is to get public health out there and start working on the chronic disease end of things, rather than just being reactive to things. Get out and do things in advance. And then it's got a fully equipped vaccine fridge. So we can do, I talked to the hospital about this, we can provide the vehicle, they provide the nurses and vaccine, and we can do vaccination clinics. And working in a partnership, so it saves all of us money.
I was just thinking, you get the 2 senior centers too.
Yeah, we got the senior centers that we'd be glad to show up and do activities with, especially A1Cs and that kind of thing. So it's going to be really useful for us to get out there and get public health, like I said, out of the office, especially on the chronic disease and immunes. So, and basically the other expenses will be essentially the same as what our RV is, as far as fuel and stuff goes. It gets lousy mileage for a car, but it gets great mileage for a house. So it's going to get us out there, and it's going to improve our look too. So that'll be good. And other than that, we're keeping our eye open for funding that's coming along. Because we have more than 25% of our residents travel out to metropolitan areas for jobs, we're now no longer considered rural, and a lot of funding streams were considered micropolitan. So we don't get the same rural advantages that we used to have. Micropolitan. So instead of a metropolitan, we're micropolitan.
Sounds like ice cream.
Yeah, exactly. So that changes some of the things that we can apply for. And we're trying to address that by writing language into the comprehensive plan that makes it very clear that we're still a rural county, and we can align grants based on our comp plan and get the language to match and hopefully make it more attractive to get some of that funding. So that's a lot of what's going on right now, and we're not the only health department that's going through this. We have the Rural Health Transformation Program or Plan across the state. We're putting that together. We've been working with DOH. I talked with Dennis Worsham at length about how that money can be used to support. I'm really concerned that we've got 6 to 9 critical access hospitals that could close.
Mason Health is not one of them.
And Mason Health is not one of them.
Geez, I've had to go around to every meeting,
Yeah.
known to man and say,
Yeah.
we're not closing.
I know, but we pulled 990s for a lot of the hospitals, and some of them are just really right on the edge. So
there's a couple that have been on the edge for the last year.
Right. There's a number of them. So we're looking at that. How do we write that plan to make it as attractive for the vets to make sure we get that slice of that money, at least the first tranche of that money, which would be $500 million that comes to state.
Rural funding?
This is for rural funding only.
Is Eric already sent it off? I know he sent a letter off
Right.
immediately as it opened.
Right, yeah, so the requirements dropped a week ago Friday, so we've been working on that really hard since then. To make sure that we have an opportunity. I have some concerns that we won't get the second tranche based on conflict between administrations. We'll have to see. I would like to see organizations other than the Accountable Communities of Health being the organizations that decide who gets the money. Now, the tribes get their own complete set aside.
We do.
So that's great. I don't have to worry about tribes. But we've got the Centers for Latino Leadership. We've got a number of folks that are traditionally gotten left out of the loop. And we're trying to figure out how to make that happen across the state, as well as what does it mean for Mason County? How many dollars do we get from Mason County to support our local rural health? And it's not to replace Medicaid funding. If we have anything in there that says this is a replacement for Medicaid funding, they reject the application. So it's taking a lot of careful writing on this one.
All right. Any questions for Dave?
I'll throw one out there that came to our attention. There's a new clause coming in on all these federal grants and probably any funding. which basically goes directly opposed to Keep Washington Working Act. So we're, as a county, we're between a rock and a hard place. If we take any federal dollars, in most cases, it's gonna be transportation dollars. We can't, we're signing a contract that says we will violate state law. We can't do that.
Right.
So I would imagine you're gonna be
Yeah, and we're
in that
working.
same boat.
We're in that same boat. So we're trying hard to figure out how do we word things to make the application acceptable. Because I have to, two masters I'm gonna have to answer to.
You're used to that.
Yeah.
Okay, Ian.
Good afternoon, yet? Yes, it is.
Yes.
Good afternoon, everyone. First up, I just want to mention that we will be at Oyster Fest in 2 weekends. First weekend in October, doing water quality education, along with some septic maintenance stuff. And we'll be out there for both days. Secondly, we have a response to our letter to Craft 3 on behalf of that homeowner that had the system that failed within a year. And they still denied them again, unfortunately.
Really?
Yeah.
Did they give us a reason?
I can tell you all the details, but I don't know if you want to make
Okay.
personal details public.
We can speak later.
Yeah. And then, any other questions about the Craft 3? Next is the on-site septic waiver expiration. So that's the item that Paula had spoken about up there. And I just sent everyone her email, but I believe Cammie had already sent it to everyone. So basically to summarize what that's about, in Mason County, historically, we've considered waivers to be their own separate permit. But from the perspective of the state on-site septic regulation, a waiver is just an aspect of the septic permit, and that's how it is in state law and state regulation. So, because of our misinterpretation and misuse of that, we've had waivers that just stayed forever. I mean, literally forever. We have waivers from the 90s and early 2000s that are getting used on septic permits tonight. And there are things that we would never be able to allow. So they're really not good. It's a change we have to make to view it the way the state WAC reviews it and just have the waiver expire with the permit. If there's any concerns about like what happens if you get a waiver or something and then your system's in and then your waiver expires, it doesn't happen like that. Your permit, once a permitted system is installed, that waiver stays with that permit into the future. We're not gonna come after the person later and say, hey, you installed your septic system too close, because that's part of that approved and executed permit. But if a permit is not installed and the permit expires, the waiver expires with that. And that'll bring us into alignment with the state code. Paula's contention is she's trying to, look out for the consumer and the cost that we have for our permits. And for our permits.
So let me, layman's terms here, so if I go get a septic system and I get granted a waiver because of the way my property's configured or whatever else I have to put in the septic.
Yeah.
That waiver's good as long as I have that septic in?
Yeah.
Even if I sell the house?
Yeah. Yeah, the waiver is tied to that septic system that was installed. It was officially approved to go in that location, closer to the house or closer to the shoreline or closer to a well or whatever the setback is that you're getting the waiver for.
So I don't think I understand then. I thought this was, you apply for a system, you get a waiver, you don't put it in for 20 years.
That is what it's.
Yes,
That is what it is. Okay,
Yeah, that's
so,
what this is fixing.
so if it's already in the ground, that's nothing to do with the waiver.
So the waiver is, I'm going to build, right?
But you
We put this
don't.
in layman's terms, I'm going to build, you gave me a waiver,
But you
and
don't.
that waiver stays indefinitely?
No,
Right
Right
the way
now.
we've been doing
The way we've been doing it, it
the
stays
waiver stays
indefinitely.
indefinitely,
Okay.
even if that system was never installed.
But according
Okay.
to the WAC,
So again, if I have the property and I'm gonna do it, and then I don't, and then I sell it to Eric, that waiver does not follow with Eric. It does
It
now.
does now,
What you're
but it
saying is it
shouldn't.
shouldn't.
It should not.
Correct.
And that could change depending on the septic system designer designing it in a different way.
Yeah.
Well, I'd
But they have to start
I'd almost
over.
argue that if you got a waiver tomorrow and you sold the property to me next week, that I bought that property saying I can put that septic in, and then you say the rules change, so I would probably want a clarification on how that would work.
In that situation, if there's no change to that.
Okay.
If you apply for a permit, I mean, it's gonna depend on your designer. If your designer says, I don't know, you don't know, I don't wanna work with you, then you're gonna have to get a new permit.
Okay.
That's the bottom line with that, but, that's with any permit that you have. But from the county perspective, we're not gonna have any problem with a new owner buying the property with an existing issued permit and then installing that system with the waiver or whatever.
As long as it's within a certain time frame.
Yeah.
Or the permit frame.
As long as the permit's not expired.
Okay.
And how long is that permit?
It can go as long as 5 years. It's 3 years and then you can get a 2-year extension.
So in general, it's gonna be a 3-year.
In general, it's 3 years unless they get an extension to go to 5. There are some people that get that 2-year extension, they still, like Paul said, for financial reasons, couldn't get the system installed. And then at that point, they're gonna have to do a new design. And you gotta keep in mind, so many things can happen with a property in 5 years.
Oh, yeah.
Property use, driving over things, destroying the soils that were originally slated to be a drain field, so.
Or change in use.
Yeah, major changes in use, yeah. But so, Paula is essentially trying to save, when you boil it all down, Paula is trying to save, money for the people that are paying these fees. And so her proposal to make the waiver be good for 10 years is not something we can do officially, or like, this waiver is good for 10 years. That's more like a internal financial decision for the department, in that what she's really asking is, are we going to not charge a fee to do a review for that waiver? And just for some perspective, the septic permit is $825, and the waiver, if it's a local waiver, it's $200, if it's a state waiver, it's $305. So it would be, her proposal would be saving that person, let's say at the most $300, by doing that. Now, from an internal standpoint, from our workload, we're still gonna have to review that application thoroughly and review for the waiver portion of it,
So we're saving somebody who, I'm sorry to interrupt you, so I'm trying to wrap my head around this. So we're gonna save somebody $300 for a $30,000 septic system.
That's all
50.
yeah.
Okay, well then let's go $50,000 septic system,
Nowadays.
and here we're gonna save you $300. I'm having a tough time swallowing that one.
Yeah.
But, I mean, I don't wanna speak for Paul, but
No, no.
when I read, what she sent, that's, at the end of the day, that's
You're
what
still
she would.
incurring your costs.
Yeah,
You guys are.
at the end of the day, we would be not recouping the cost for our review if that situation were to occur where they get a separate permit. And again, they would still be paying the $825 in her scenario, they would just be saved this extra $305 if they didn't have to go to get the waiver approved again.
Unless they have to go through the state, and the state's,
Well, it's still the same process.
Right.
and there's still a cost.
Yeah,
And there's still a time that our staff has to spend doing that, right?
Yeah.
Right.
So I don't, as far as that part goes, I don't know if that's even a Board of Health discussion, that's more of a internal financial decision between Dave and our finance manager. So maybe something to revisit, but other than that, I don't see any
We're still looking at
substantive.
3 years. With 2 one-year extensions, not 10 years.
Right.
Got it, okay.
So,
Yeah,
and typically, septic system regulations change often enough that you're gonna wind up with new things.
Yeah, I mean, 3 to 5 years, that's max.
Yeah.
On what they're gonna change. Plus, our permit, as a county, those permit fees will change too.
They can change every year.
Yeah. Okay.
Yeah, they're an indexed fee. So,
But as far as proposed changes that she has to that policy that you have in front of you. I can't see us making any changes based on her feedback. Because like I said, at the end of the day, it's more like an internal financial decision. It's something that I think we can talk about, or as far as like internal fiscal policy, whether that's something that we can do and absorb within our costs. But for the purposes of us, moving into compliance with the WAC, I don't recommend any changes to the language that's proposed to it. But that's my opinion. What do you think?
Makes sense to me, as long as it's transferable, because I could see him wanting to sell me a piece of property, and I'm saying, well, if I can't have a septic, I don't want it. So he's gonna go out and spend the money to make sure it's gonna be approved, and then I'll say, oh, yes, I'll buy the property now. So I get that, so long as it's transferable for that 3 years at least, I'm okay with that, it makes sense to me.
Yeah, and like I said, though, the only issues that I've seen with that are when someone buys the property and then they go to that septic designer who is kind of the custodian of that project. And they say, I bought the property, I'm gonna put this in, and they say, no, I'm not working with you. And it's usually some kind of business relationship history.
Because somebody was a friend to somebody else and decided they'd do it and.
Or they had a bad experience with that person in the past, and they said, I'm not working with you over again.
So Ian, it mentions, I was gonna look it up real quick, but I'm just gonna ask, because you're faster. In the WAC, it says that, what's the minimum land requirement?
It depends.
So in
Oh,
WAC,
so the minimum land requirement
yeah,
is the amount of area that you're allowed to, that you have to have in
So it
order to put a
depends.
septic system on a property.
so it
And
depends on the
that's-
size of septic,
And
or the
it-
size
well,
of septic too.
It depends on the drinking water source and the soil type. So the answer is complicated. And then there's other things you can do to like change what that number is. That's why in there, I'm just referencing that section because it's
Okay.
so complicated. We can't really put too many details on that.
It's like trying to universally put a septic on anywhere, because if I live on the Hood Canal or if I live on a creek, it's different than if I live in the big flatland out here in the valley.
Right.
Okay.
Depends on your soils, if you have tight soils, it's gonna be more difficult if you have,
Or you gotta
gravelly
pump- or you gotta
soils.
pump it uphill.
Yeah, right.
Yeah,
Some
if you have a
places,
private well, you need to have more property.
some places, in order to meet the minimum land, they're pumping it under the street to another piece of property that they buy specifically for putting the septic system on.
Okay.
That's happening right next door to me, so.
And so these applications are reviewed by our health officer or their designee.
Right.
Who is the designee? Because I'm not seeing that our health officer is very present.
That's me.
So,
Okay.
and just for clarification on waivers, I do local waivers, but those get reviewed by DOH. Because they don't want us to step outside of, and then others we send to DOH to get waivers approved. So,
It's like a check and balances
Yeah.
process. We approve all our waivers and then quarterly we have to send all those waivers to the state.
for
And the
review.
state
They
reviews
basically
them for
audit it, make sure
compliance.
you're
Yeah.
above board.
Yeah, right.
Okay.
Okay.
And that's how this was found, was like, why did you approve this waiver? Like, well, we have this policy to accept waivers forever.
Yeah.
And,
It's like, well, let's not do that.
yeah.
Good idea.
No, I agree with that one, 100%.
But you need a motion on this, correct?
Yes, if the board likes the language in the waiver policy.
Which basically we're
so-
mirroring the WAC.
So I make a motion to approve the policy change on waiver expiration.
Second?
I'll third it.
I got a second and a third. All those in favor?
Aye.
Opposed? Done.
All right, next item is, the OSS enforcement. It says referral policy, that's a typo on my part, it's a deferral policy.
Defer.
Yeah, we're
Do you have that in there?
deferring enforcement.
Do you have that in there? OSS code enforcement.
So we, just so everyone knows, we received a, letter from, Ryan Finn about this policy change. Did all of you receive that?
Yeah, pass that
Okay.
down.
There's a lot in there. I don't know if you're prepared to have a discussion on it or not.
I'm not.
Okay.
So, if I'm reading this correctly, clarifying on all the conversation today, this goes back to the vote where I said we shouldn't change it, but it got changed and voted yes, correct? Regarding the dump,
No.
solid waste
No.
dumping, the
No.
septics and the porta potties?
Well, no, that was mentioned, that is one thing that's mentioned in here, but.
Got it.
But the main root of this is not that.
No,
That letter touches on a lot of things.
Okay,
But the target of it, I think, partially at least anyway, I don't wanna speak for Mr. Finn, but, the target is today's, proposed policy change, and that was just to remind everyone, the policy change was in response to an appeal we had from a landowner who was living in an RV, is on a fixed income, and, has no public health issues on their property. And at that time, the board had voted to create a policy to address some of that, to defer enforcement action. So this letter is largely focused on that policy proposal.
and not on somebody that has a big site where they're destroying
We're just
cars.
dumping, yeah.
Right.
Well, it deals with the dumping.
I mean,
Yeah.
it could be involved in that. I think that the letter is pointing to some of that, saying, well, this property that has this huge junkyard and is dealing with this situation, could be granted leniency
Right.
under this policy.
And
But
we
that
don't-
is, but that is not the intention, and that's why one of the eligibility criteria is that they can't have public health threats to their property. That means no code enforcement cases other than the case that's just because they're living using a porta potty. But it, it sounds like nobody's really had the time to absorb all the feedback in that. I don't know how far we want to go with this discussion.
So it sounds
Or if we
like
wanna have-
you're not ready to discuss it.
No.
I think we
No,
wanna table that for now.
So I will entertain a motion to defer this over to our, at least our next meeting? Does that sound reasonable?
What's the date of our next meeting?
I don't know, I'll have to look.
November?
November.
No,
And I think we fudged it
you have to pick a
based
day.
on,
Thanksgiving,
yeah,
Holidays, right?
so I don't remember what day it was.
because we took it off of Thanksgiving week.
Yeah,
And
Can you
Amy,
just stick to
did
the
did we go
November
at a week
I've got the
afterwards?
25th
Yeah,
on my
so-
calendar, does that sound right?
I have it on the 25th as well.
and when's Thanksgiving?
Yes, I have it on
The 27th.
Oh, okay.
Yeah.
Yeah, that's
Yeah.
right. It fell in a year when it really didn't affect Thanksgiving.
Right.
Then I move to table
Yes,
the draft.
Tuesday the 25th.
Okay. Then I move to table the draft OSS code enforcement deferral policy to November 25th.
Do we have that at
I'll
11?
second.
Is that, hold on a minute. Is that at 11?
That's a lot.
That's 11, yeah.
Okay, I'm not gonna be here.
Do you want to defer it longer?
I hate to.
Well,
Yeah, we
and that's
can't really-
Thanksgiving week, we could change the meeting.
Yeah,
Can we move it up in November?
I don't think that's a problem, I don't care.
It would have to be the week of the
You could also have a special
Yeah.
meeting too.
How about the 11th?
11th's a holiday, Veterans Day. We could do the 12th.
12th?
So Wednesday.
How's your calendars look for the 12th? It's a Wednesday, November?
fine with me.
My calendar's full, whatever day.
It doesn't matter.
Doesn't
It says
matter.
meeting?
It just says meeting.
For November 12th, we have hearings in here at 1.
In here at 1.
Yes,
And if-
Yeah, but if we just do a special meeting to address this, we should be able to kick it down an hour or so, right?
Yeah,
Yeah.
I feel like we
We
could.
start at 11, get out by 1.
okay,
Do I?
Yeah.
That sound reasonable?
that sounds reasonable.
Okay, I'll entertain a motion for a special meeting November 12th at 11 a.m.
So I move to table the draft OSS code enforcement deferral policy to a special meeting, November what?
12th.
12th at 11 a.m.
I second that.
All right. Thank you, Ian, but we're gonna put you over for 2 weeks.
That's okay.
So you can
Did we have a
digest.
vote?
Oh, sorry. We kind of voted.
We discussed it.
All those in favor of November 12th?
Aye.
Any opposed? Done.
My wife's opposed.
Well, that's the
It's
Thank you, guys.
I was gonna say it's anniversary or birthday or something.
Mine was Saturday, so.
Honey, I'll take you to lunch after the meeting.
And his wife.
And his wife.
No, no, that's
No, I
what
said,
I'm
that's
telling
he's
my-
gonna go tell her, honey, I'm taking you to lunch after the meeting.
Peggy, I like your idea.
Yeah, he could take both of you.
Letter State Board of Health.
So,
Okay.
the next item we have is the letter to the State Board of Health. Mr. Finn's letter, Mr. Finn's letter did also mention that in part of in part of the letter. But I think he's confused on what we're asking for. In this, just to remind everyone, this is that we have a situation right now where you can, under the septic code, you can apply for a permit with a waiver to install an RV holding tank on your property, to be used 6 months a year or less, with some, high water alarm, maintenance requirements, there's, various things, but that exists currently in Mason County. Now, the state code changed recently, and when they changed it, they made it really clear that you couldn't issue waivers on undersized lots. And so we have a lot of properties in Mason County that are small lots, they're undersized lots, and all you can really do with them is make them a, camping property where you can get an RV holding tank for your property and stay there, part-time. So in the previous meeting, the Board of Health, based on that discussion, had chosen to send a letter to, at that time we had said the State Department of Health, I amended things, I've changed things a little bit since then. The State Department of Health requesting that in their next rulemaking, they consider revising that to allow you to build it into the code, where it's not a waiver process, that you can install an RV holding tank if you're meeting all those standard requirements, to have an RV holding tank on your property. So
Can you give me an example what an RV holding tank is? I mean, I'm picturing
It's
those
just
blue things that you just
no,
hook up.
it's a septic tank.
Septic tank, typically, it's 1,200 gallons, isn't it?
Yeah.
Yeah.
So it's not just these little plastic
No.
things that people are filling
No.
up?
Typically,
No.
it's concrete in-ground with alarms.
No drain field, just
Right.
pump it in there, just pumped
And
out.
then it gets
Yeah.
pumped out.
Yeah.
Okay.
Yeah, technically the pump tank, it doesn't usually have like the baffles in it to do
Right.
separation, but yeah, it's just a big septic tank that is storage.
And then you call them to come pump it out,
Yeah,
more often than you would a septic.
Yeah.
yeah. So.
I don't know that I've ever even seen one of those.
Well, you wouldn't see them, they're all over the place, you would never see them, they're just, it's gonna look like any septic system, is just gonna look like the regular little manhole.
So they're buried underground.
Yeah, they're buried underground. Yeah, we don't allow septic
It
tanks.
probably cost you a fraction of what a septic costs.
They are inexpensive, the cost comes in
The
the
pump.
back end when it comes to pumping.
Is it direct pumping in from the trailer, or do they actually just let it out when they want to?
It's usually, they usually plumb the trailer into the,
Okay.
into the,
And then I call AAA septic or whatever to come
Right, and
pump
they
it.
have you on a schedule, yeah.
yeah.
But $350 a pump out, it adds up.
It's like double that now.
Oh.
I know, the price has gone way up.
I paid almost $3,000 out of Bay Shore on all my tanks.
But it's
So
needed. But it's needed.
Yeah.
it's needed, there's no public health reason to not allow these to be installed on small lots versus big lots. Because the reason why they have the minimum lot size requirement on waivers is so that you're not creating really high density of septic systems on a whole bunch of small lots, which can cause groundwater pollution. With an RV holding tank, there's no pollution source because it's not going into the ground, it's just storage.
It's contained.
It's contained, yeah.
So again, going back to my example, this would deal with some of the houses on the Hood Canal and such that are just these small little lot houses.
Yeah, so a lot of those little lots, gun smoke, little lots on the shoreline have no reserve areas. A lot of these were built, decades and decades ago. If something goes wrong, I mean, they're probably gonna be stuck with something like this.
Because they're probably pumping up the hill.
Some of them are, some have nowhere to pump it.
Yeah.
So how would that tie into a code that how long this trailer can actually be on this piece of property? Is it like year round?
It's the requirement for the waiver is 6 months.
Okay, so, and we can't have 8 trailers pull into
To one pump.
that undersized lot and fill up that tank and,
I mean, people could.
because that would actually help this problem, I mean, not help, it would create more problems like these people are having, no enforcement if 5 trailers can hook up to that and be legal.
And it's not an issue until there's overflow, is the bottom line of that situation. Someone could do that, they could park 8 trailers on a little shoreline lot and all be going into this holding tank, but that could be the situation with a regular permanent septic system too. And that happens, and we get septic systems that fail and are blown out because of misuse.
And I just keep going back to the water stuff, because I know county-wise, there's all kinds of reports that keep coming out on a regular basis of failing septics on the creeks or failing septic in the rivers. And
That's drain fields though.
Yeah, and we can typically get those cleaned up pretty quick.
Yeah.
Yeah,
I
we
mean-
have a pretty quick response time on septic.
Would the tribe have any insight on that as well, or, I mean,
It's not something I can speak on
Yeah.
if that's the case, yeah, sorry.
Well, that's-
have we checked with the tribes if they have any issues with something like that, especially on water lots?
Well, during the discussions on RIA 14 and 15, the tribes are really concerned about installing septics on undersized lots. In preferring to go with sewer systems, or, large on-site septic systems where you combine several lots to one lot. So you give up one lot in a development and that becomes the septic.
Okay.
To your question about the tribes, this is not really this decision is not really one that you would put forward to the tribes at this point. This is the board requesting an action by the State Board of Health. If the State Board of Health chooses to change the regulation about holding tanks, then it will go for public comment and and the tribes will be solicited for their feedback on that regulatory change at that point. So this is not a regulation change we're trying to do right now.
Okay.
Do we know if other counties are having the same issue?
Yeah,
And are they writing similar letters, do you know?
there's at least one other that's writing similar letters. There was the last thing that went before the State Board of Health related to this, and it was frustrating to watch. They had a hearing where someone was trying to address this issue, but they didn't provide all the details, and this was a homeowner that was trying to use their property. And they were in Jefferson County, and they petitioned the State Board of Health to do a rulemaking to allow this, but they failed to mention that they were on an undersized lot. And so the state, when they responded to the Board of Health about this inquiry, they just said, it's already legal to do this, case closed. And then they ended it. So they unfortunately, the petitioner, missed that critical detail that I was denied because I don't meet the minimum lot size. So.
All right, what do you need from us on this one, Ian?
This is just,
A letter.
the board already approved sending this letter, but there were some changes and we made, we basically are sending it to the Board of Health versus just DOH. It's going to the State Board of Health and DOH. So just approval to send the letter, and if everyone's good with it, then we'll print a copy and have you all actually sign it. Because there were several people that suggested that we carry more weight if it was signed by the board and not just,
I think I sent that out.
You weren't the only one, there were several members that.
Yeah.
Yes.
Yeah. I make a motion, we approve this letter to send to the State Board of Health.
I'll second.
Any further discussion? All those in favor?
Aye.
Opposed? Done.
Awesome, thank you.
I'm testifying at the State Board of Health in 2 weeks. They asked me to come in and address rural health. First time I've been asked to do that.
You can take 20 people in with you to discuss what.
That would be
Got
fun.
a whole group that would be happy to go talk.
Yeah.
Okay.
All right, we gotta laugh at these meetings once in a while.
Especially on camera.
Community health report.
Good afternoon, everyone. I'll try to keep it pretty brief because I know, are we supposed to be until noon? Or is it as long as as long as it takes?
As long as it takes.
Okay. Well, I won't take that long. I'll just highlight a couple of things, unless there are some specific reports or questions about the report. Piggybacking a little bit on what Dave mentioned, we're super excited to finally have our medical unit. It feels like we've been talking about this for years. Maybe we have. But you'll probably see, you know, once we get it out on the road, the priority right now is for our syndemic clinical services, which is the expansion of our syringe service program. We're already partnered with North Mason Regional Fire Authority and their mobile integrated health program to do like infectious disease testing, so HIV, hepatitis C, STIs, that type of a thing, and then also get people kind of a warm handoff to providers so that they can initiate treatment. So we've been doing quite a bit of that over the last, I think it's been maybe 4 or 5 months already. North Mason has been a really wonderful partner, and they are excited to continue our partnership with them permanently as long as funding's available. So I'm working on plans on kind of getting the new mobile unit rebranded and ready to kind of hit the road. That'll be kind of the first thing. Secondly, another thing that I really wanted to highlight, which involves WIC, is we've had a really exciting new partnership with Washington Correction Center, WCC. The Department of Justice has, or at least the DOC, sorry. DOC has, I think they applied for a grant, which got them some greenhouses, and they've actually been planting a lot of produce that they've actually had to dispose of a lot of because there just wasn't people to come pick it up and use it. But as part of that grant, I think 51% has to be donated to programs within the community. So in a partnership with Hope Plaza, WIC, and I think some of the food banks, somebody volunteered to rent a U-Haul and go pick up a big load and deliver it to the food banks. We're getting quite a bit at WIC, which is being distributed out to the families along with like cutting boards, measuring cups, and some recipes so that the children can be encouraged to participate in preparing, selecting, and trying new fruits and vegetables and things like that. So the biggest thing I want to highlight about that is one, it was a very creative idea, and it didn't cost us anything. So I have to give kudos to our WIC team. They've just been really creative and have really made it something that hasn't really cost us a lot. I think the majority of our costs are really associated with just salary and benefits. So we'll do some internal conversations about just contingencies there because losing WIC again will have, at this point, impact 855 families. So we'll work with our staff on how we can prevent a huge impact on that. Secondly, the other thing I wanted to highlight is Washington state law requires for local governments to develop a 5-year local homeless housing plan. The county contracted with facilitators to actually develop this plan for us. So they've had, Eric, you participated, they've had meetings, workshops with local stakeholders from both the city and the county level. It involves building and planning. All of our homeless service providers participated as well. We've received the first draft of that plan, which is attached to the community health report. It's a long report, so staff have tried to kind of provide some prompts. If the board is able to just review.
I did review it, and I thought that they left out North Mason pretty much. Most of North Mason doesn't even know Shelton exists. And they are very involved with Tacoma, Silverdale, Bremerton. We have probably 80% of our population that never comes this way. They go the other way. And I didn't feel like this plan reflected that.
That is helpful feedback. So where I was going with that was if the board can, if you're able and you're willing to review, again, there are some prompts to help maybe narrow it down, because I don't know how long it is at this point, maybe it's 70 pages. help target a little bit of where
It's
some
at
of the
least
feedback is
50, I know I was falling asleep. Right.
Yeah, well, that's that kind of feedback, like, we're really looking for, to give our facilitators some really helpful feedback on how they can make it even, so words is a lot. The feedback that I gave was more tables, more text box things to help things stand out a little bit. But especially what we're looking for is, this plan needs to be something can be implemented and, we wanna set our system up for success. How are things gonna be measurable? Are they realistic goals? Another part of this assessment was, it includes a pretty comprehensive survey of fund sources. So looking at the sales and use taxes that are available for things like affordable housing, for example. The purpose of the plan is, how are we gonna take those dollars, how are we gonna apply those dollars and start doing things? So that's an ask. If you have any questions, feel free to reach out. If you wanna bounce ideas, or if you even wanna be connected with the facilitators of the plan who are kind of writing it for us, I'm happy to do that as well.
I actually haven't read it yet, but we really did not talk a lot about areas, we just talked
Yeah,
about.
I know, but they discussed Mason Thurston, and they also discussed the, fact that people travel out, but they didn't really say much about North
Makes
Mason
sense.
going the other way.
It makes sense, but we didn't, but it wasn't a focus of the group, it was
No,
a
but
3-day,
it's
full
in
3-day.
there.
Okay, yeah,
And
well,
they-
I'll read it, but.
Yeah, they also talked about the Bremerton Housing Authority, and I remember that part of the Quixote problem was that the Bremerton Housing Authority didn't give the vouchers.
There was definitely a problem.
So that needs to be a connection too, and, I just felt that there was things left out.
And we know that 50 pages puts you to sleep. 51
Yeah.
puts you to sleep, 51.
I mean, I had to go get another cup of coffee.
It took me a few days to read through the first draft, so.
It was very,
It's
very
one of those where you
productive.
highlight it and go back to it again. and
Yeah,
look at it
I'm
later.
sure it was, and I know they did a lot of work, but I just felt like that area wasn't representative.
Could have been addressed better.
No,
Yes.
that's great. No,
Fair enough.
That's super easy feedback to give to our facilitators. And then finally, I don't wanna take Ben, I'll hand it off to you in a moment, but on the last Board of Health meeting, we went through kind of a proposal to do a voluntary agreement with our local retailers who sell kratom, other substances that are non-regulated. So I'll hand it over to Ben and maybe he had a couple of questions for the board. We provided a copy of, kind of a more formal agreement that would, I think would be intended to bring to the stores for the store owners to sign them, and then the Board of Health can sign it, and then it's really just kind of it's a formality in that we'd like to have it documented and acknowledge that they've agreed to do these things, but there really isn't a whole lot of enforcement involved in it because there's no laws or regulations associated.
Need a motion to move to allow Ben to the agenda, or?
Sure.
I move to
Yeah, he's
allow
not on the agenda,
Ben
so
on the
the-
agenda, under 8C.
All right.
I second that.
All right,
All those in favor?
Aye.
You are 8C, Ben.
All right, thank you. First of all, I want to make a comment on this, and it has nothing to do with this. Squaxin is breaking ground on their new clinic, and I walk my dogs up there. The big trucks are up there ready to go, so that's really kind of exciting.
Where's it at?
It's on the reservation, I mean, Patrick, you may be able to better explain the location of where it is.
It's on the end side, so like you have to kind of drive through there. Is it?
It's on the other side going to a
Yeah, so you have to like
Yeah.
drive through the reservation, or you can take, I think, Bloomfield Road.
Yeah, there's a back.
Yeah, that way too, so.
Yeah, it's a big field that they initially cleared out for the paddle 12 years ago or so, and it's been clear, they've been talking about doing a lot of changes. I live out there. So.
We're excited.
Yeah, and they have a big map sign up there that shows what the plan is, so it is exciting. A lot of extra homes too, right?
Yes,
Community
yes.
center.
It's gonna be connected actually to housing development, so.
There you go. Did I digress? So we've been working on this for a year and a half at least. We're gonna getting some data and information about kratom. I've gone around to every store, and told the story last time. Some of the data we had really received was from our youth. And this meeting was today and school just started, so I had to really hustle to try to get some listening sessions in with our students. And we just got that in yesterday, and it was really interesting. I took Monty, what's Monty's last name?
Arnold.
Monty Arnold, a new staff member at Public Health. I brought him with me, and Jamie Taylor, the coroner. She was here last time, and she presented a little information on kratom and nitrous oxide and mushrooms that a lot of our convenience stores, about half of them sell. We took the listening session to the students. Interesting that about half of them, you know, digress a little bit too. We don't want to educate new drugs, right? We, you know, the old DARE program would come in with, these are all the drugs, and it was just giving students ideas. So how do you do a listening session with students without, you know, trying to get information and without giving them a new drug that they could possibly go purchase underage, right? So that was a little difficult yesterday. We had to kind of skirt that issue. But about half the students have even heard about kratom, which is a good thing. Most of them have maybe seen a sign out. A couple of students worked in convenience stores, so they knew of it. But the real positive thing that we got was most of them really don't know anything, and that's a positive thing for our youngsters. Now, this was a small sample size. There's only 2 classes at Choice High School, and we plan to do some more at some of the other high schools and try to get a more diverse group within our community too. So we'll be doing some more of that. But what we've been hearing through John Holbrook, who came into the training here probably 6 or 8 months ago, that it's happening. It's happening with our youth in our communities, around our state and around our country, and that 20 to 28-year-old group, they're really using the supplement kratom, and it comes in a lot of different ways, in powder form and liquid form, and if you go in the stores, they're all over. So one of the things we decided at our last Board of Health was not to really create a law or a code or anything like that, but maybe an agreement that we would draft up, and which we did, and you have in your packet. So what I'm looking for from you today is, how should I present that to the store owners? Most of them said that they would be willing to agree to lock or put it behind the counter, bring down the advertisement. That's gonna be a tough one for some of them, I think, because ownership sometimes is out of state. But with the sandwich boards, stuff on the windows, that sort of thing, we'd like to just have them take that down if they're willing to agree to that. And then ID kids, because there's no age limit. So those are the 3 main things we put in the agreement.
Well, if there's no age limit, so we're asking them to voluntarily ID and voluntarily not sell to under 18?
Exactly, that's exactly.
Good luck with that one, Ben.
I know, but that's.
I think it's a great thing.
Yeah, it's not the perfect system, and, you know, we're hoping that our feds actually come up with a law. They're discussing it right now, and our state has been discussing it, the pharmacological group in our state. They've been discussing it. They just don't have enough data yet either. So I think we might be one of the first that really have pushed it, and Mayor Nisco, thank you for your help with all this stuff, because I know you were like one of the first to really, you know, say, hey, this is happening, and you own a store and you heard about it. So that's where we're at. The other thing is the look of the letter. What kind of logos do we want on that? And I'm willing to go around and talk to the owners and the clerks and get as many signs as I can. The other thing is, how would we want to acknowledge those?
I was just gonna say, you need the carrot to go with the stick there.
Yeah.
So
Yeah.
how do you put out there, whether it's county website or Facebook's or whatever else, or advertising that says, these have voluntarily agreed to help our youth in our community, and this is how they've done it.
Put it on our webpage.
Yeah.
Because I think that's gonna be a big.
Healthy
I
Mason.
agree, yeah,
If I'm owning a store, I want you to acknowledge that I'm doing what you've asked me to do.
Yeah, well, I'm wondering also, could you reach out to Eric and put something up at the hospital too? Because we're the Board of Health, so maybe pharmacies in places like that also could put something up, I don't know, if it looks nice.
I mean, you get something for them put on the wall that says, this establishment supports Mason County Board of Health's, whatever.
You could even call it certified, it's certified, but
Yeah.
nobody cares
I
what
mean,
it says, it's just a matter of
Okay,
certified
sounds good.
or by the county
Something
board of
nice.
health.
Right.
Yeah.
As kratom free or helping our youth or something about.
Yeah, sure. Yeah.
Eye-catching.
Yeah, and we can probably come up with some sort of, thing, and
You might even get the paper to put
Mhm.
something in there that.
Or we just take an ad out of the paper.
by the way, we're using the Little Creek Casino, electronic
Oh,
billboard
yeah?
to do some stuff for our social norms project too.
That's awesome.
That's-
They
it's
offer
really-
the lease, right?
Yeah.
So
The city won't let us.
out of curiosity, is it now the
what?
KTP stores and stuff, have you talked to them?
I
I don't even know if
the
they sell,
travel
I'm just
stores,
asking.
I have not,
It's the
I've
same-
gone in
it's
there,
the same code won't let us have
I
it.
have not talked to them about this issue.
For where?
I don't even know if they sell it.
I don't know either, but, I mean, I could,
Great
I
spot.
mean, we really don't have.
Right there.
They might be willing to voluntarily,
I can ask some questions too.
yeah.
Yeah, just,
Yeah.
it's really only two,
And
right?
I'm okay going to.
I don't think they sell kratom though.
Yeah, I'm okay going to a council meeting or whatever it takes, that's, I'm kinda used to that.
And we're only doing the ones that are in Mason County, because I know that
Correct.
Tribe has others, so like in
It's like
Thurston.
39 or something like that, 30 something. So.
Cool.
I think it's a great start. I still think that we should look in the future about banning or,
Yeah.
hey, restricting some of these products.
There are
There's
going to be pre-filed.
I mean, Jamie explained to us that we even have overdoses from this stuff. And even though that the kids aren't 100% on it now, we know that in Renton that John is finding a lot of stuff in backpacks and in locker rooms. I mean,
Yeah.
and the space gas is ridiculous. Come buy this, stick it to your face and inhale this and, see how long it takes before you pass out. It's just ridiculous. The kids can buy this stuff.
Quick high and it's doing a lot of damage.
Yeah. And I bug her 35th every time I see them. And also Emily Randall's office, I saw James Bray last week, I mentioned it to him again, but the feds are actually working on kratom itself, but there's still 30 other things that kids are buying at our gas stations today that shouldn't be confined, so.
I've been sending a list too.
Yeah.
Chris saying, add this to the list, add this to the list.
So how many of you, if you hadn't seen the signs before, since we've talked about them, have you noticed some of that?
I saw them before.
I
You
didn't
knew about it.
notice them before.
I know that some,
Yeah, we went and checked out a few stores after we saw
Yeah.
Mr. Holbrook. And
Yeah.
we went in and talked about it. It was interesting. We were up at Union gas station and went in there. We were actually closing up a ballot box, so I thought we had time to kill. We went in, talked to them. And there was actually 2 users, adults, who were saying, no, this is great. It helps me stay off of drugs. So there are benefits to that stuff.
And
the way I look at that, the opposite is, there's a lot of people that say that they're using it to stay off of heroin, or in place of heroin because they can't get it. So I look at it as a public health issue. Are we then supplementing them with another drug?
Right.
Oh,
Because they can't get it.
quite possibly,
That's the
but
way
what does methadone exist for? if not that?
Suboxone.
Yeah.
Morphine, yeah.
Yeah.
And that's medically managed, right?
For the most part.
Yeah.
I tried.
Okay. Any input, any other input?
I think we have a good direction. Thank you.
Thank you.
Didn't go out and
That's
talk
letter
to
too.
the parks after the home.
I think this one's,
Yeah.
mostly
It's
done.
not associated with the county that hands the methadone.
Yeah.
It's a trailer that they hand
Yeah,
out there.
yeah. Evergreen treatment center.
Yeah.
I've seen them over there the last couple, yeah. And I'm thinking, there's no reason for them to be there. And especially if they're not associated with the county at all.
Well, you can't tell them as a county where to park.
Eric, I thought they were gonna move to Crossroads.
City can.
Apparently that, they've been trying to get a hold of Crossroads and nobody's returned the phone calls, but yes, they're supposed to move this last week. And they haven't been able to get hold of anybody. That's the last I heard, and that was like maybe Thursday last week.
So you're gonna put this on
Yeah,
the
they should be there by
letterhead
now.
for us to,
Good.
Ben, you're gonna put this,
Huh?
you're gonna refine
Well,
this
that was,
more?
you
Yeah,
know,
we'll refine it
Crossroads
and make
got
sure
a
to get
new
the
grant
logos
for
right and
expanded
whatever.
services
Need there.
and they're moving their offices
And then you
down,
bring it
so-
back
Yeah,
to our
my-
next meeting.
So where are they moving to?
Down there in the Mill Building right there across from the movie theater, that little building
Yeah.
right there, they're moving right there, they're the main office people. So, yeah, it's supposed to have moved last Monday, but nobody's returned their phone calls, so we're working on that.
All right, thank you for all that, Ben.
Yeah.
Any other board discussion?
I just wanted to mention one thing, I don't know if it's the exchange program, the exchange program, or if it's just a different use of drugs, but I pick up garbage in the summertime, I'm a fair weather picker-upper, and I do it quite often. And I cover a lot of ground. I have not found one needle this year, this summer.
Change of drug use.
Okay, well, I just saying,
Yeah,
I don't know
they're
what's
smoking
the
it
difference,
more
but I
than
have
they
not
are
picked up one needle this
shooting
summer, and I cover a lot of ground, miles.
That's a good thing.
So,
Yeah, that is
just letting
good.
everybody know that maybe if it's a program, or if it's different drug
Well,
use,
heck, you
but.
got a
I
new
think
playground.
it's-
right?
it might be both.
Or
You got a
combination
new
of
playground
both,
that's
yeah.
extended there. Hopefully there's none there.
Yeah.
Although when I was
That's where
running the other
That's
day,
where
I
the
did
heartache
see a
comes, when you
needle
find the
again.
playground.
I've covered a lot of ground, though, I haven't found one needle this summer.
You're not looking hard enough.
Yeah, I did find one.
Talk to Ryan, he's got a whole bucket he's trying to dispose of.
Yeah.
Just put them in a bottle, it's legal, put them in a bottle and
Yeah,
write
tape it.
needles on there and tape it and go in the garbage, that's legal.
Put hazardous waste.
Who told me that just the other day?
Mhm.
Oh, Christine told me that the other day, so
Any other questions, discussions, board-wise? Meeting is adjourned
Thank
at
you.
1 o'clock.
Woo-hoo.
That's the longest meeting.